Hi, everybody. It's Patricia Coughlin. As many of you know, I had COVID earlier this month and had to postpone the webinar that's being hosted by ISTDP San Diego. It's been rescheduled and it's happening this Friday, February 4th. So I don't want you to miss this. There are two really important elements that will be our focus on Friday. One has to do with content. It's going to be about identifying, understanding, and helping patients resolve conflicts around their sexuality, their sexual feelings, impulses, wishes, and desires. This, of course, will include conflicts around rivalry, jealousy, and competition. So that's the content. But I'm also really going to be focusing on process. It seems that many, particularly those who have trained in ISTDP, get so focused on the early phases of the central dynamic sequence of identifying and working with defenses in order to get the breakthrough, that they have mistaken that process with the goal. Getting a breakthrough of feeling following the breakdown of defense is a means to an end, the end being the opening of the unconscious. Davenlu developed ISTDP as a rapid and reliable means for opening, for unlocking the unconscious in patients who are often stuck, right, in their defenses. So we're going to follow the central dynamic sequence from inquiry to defense work, breakthrough, and then really focus on that all-important phase when the unconscious is open and speaking. You want to be able to recognize that and understand it. Understand all of the memories, dreams, and associations that get de-repressed and shed light on the origin of the patient's conflict so that it can actually be worked through and resolved. Again, this whole piece of the work, which is crucial to outcome, is often neglected. So we're really going to focus on that phase. And, along with that, in most of my trainees, I'm seeing that they're getting so preoccupied with their own interventions that they're not listening to the patient and they're missing gold, basically. Okay, the patient is now spilling the beans and putting it all out there, and the therapist isn't listening. So we are going to really be listening in this webinar. In fact, I'm going to ask that people not use the chat and not be, again, preoccupied and doing multiple things at once. We can chat on the break, but I'm going to really invite everyone to be fully present and engaged, really listening to the patient. It's response to intervention that guides us. It's not all of your brilliant interventions. So I really hope you will join us on Friday. The link to the event is down below. Hope to see you soon.